So, which modality is the best modality for trauma therapy? It's a question that I am asked all the time from both clients and from therapists that I work with. And I understand that desire. I think when you're shopping for a new car, you want to do all the research, find out which has the best fuel efficiency, which is the safest vehicle. We always try to make really well-informed decisions around what is the best out there, what's the best product, what's on the market, what one does everybody like. And then that's the one we want. So in trauma work, a lot of people do the same thing. They come looking for, I really want to get this done. What modality is going to help me? And as a trauma therapist, I understand that desire, but my answer, and maybe is one that will surprise you, is I don't think there is one. I'm trained in EMDR, I'm trained in internal family systems, I'm trained in accelerated resolution therapy, I've done certifications and advanced trainings, and I love using these modalities. But I also always keep in mind that every person is an individual, and what works best for one person may not work the same way for somebody else. So when it comes to thinking about what's the best, I would rather you reframe that question into what is the best modality for me? And there are several factors that influence that. So I think if I was looking for someone to do trauma therapy with, I would talk to a therapist or read a bio or an article and get a better understanding of what modalities does this person draw from? What is their framework that they want to use? Because there are different aspects of each modality that works a little bit differently. And I think it's important to also consider factors like, what else is going on in your life? How much insurance or coverage do you have? Is this something you need some immediate relief from, or is this something that, has been sitting with you for a long time? And, it may take months or years to really get to the root of what's going on. That all should influence what modality the therapist decides to use. I probably be a little bit of cautious with a therapist who only does one type of therapy, not because they're not good at it. They're probably really excellent at it. And perhaps if they're doing good screening of the clientele that come to them and have the ability to say, I don't think we're a good fit for each other because I don't think the modality that I'm trained in is going to be best for you, then I think that can work. But really it's nice to work with a therapist who wants to get to know you, wants to collaborate with you, wants to understand your goals, wants to understand any strengths, any limitations, and then make the decision around the modality that's going to fit best for you. So sometimes in therapy world, we can get into debates. People can feel really passionate about modalities that they're trained in. I actually had somebody ask me really recently about my opinion on hypnotherapy, and I answered really honestly, I'm not trained in it. I haven't done a lot of research around it. It's not something I know a lot about. So if somebody approached me for that intervention, I would have to say, I'll help you find somebody that has more knowledge and experience than I do. But it's just not something I can really give a good opinion on because it's not something I understand or I've worked with. So, in therapy in particular, I do think it's important to look for therapists or clinics that do have advanced training in modalities that they work in, because as we know, research is always changing, interventions are often changing, even learning. A lot of the trainings that I've pursued kind of have come as a result of somebody that I've been working with. And I might hit some stuckness or something I realize I really don't know a whole lot about this, and that'll motivate me to kind of seek out some extra training or consultation or supervision. So it's an ongoing process. It's not one size fits all. There's a lot of good modalities out there. It's just really important to pick a clinician who has training and experience that will explain how the treatment protocol is going to work for you, and then give you the opportunity to decide, is this the best route for me? So even though I'm trained in a number of modalities and I love working with them all, I would never sit here and claim that one is always going to be superior to the other. I've had great results using different types of interventions, just depending on who I'm working with and what they need in that moment.